Well, some cancer survivors who have overcome the odds are facing another diagnosis: heart damage from chemotherapy, radiation, or targeted therapy drugs. It's called cardiotoxicity. In today's Health Watch, Dr. Ahmad Manshad, a cardiologist with South Denver Cardiology and Advent Health, is joining me. Thanks so much for coming on the show.
Thank you for having me, Michelle.
Okay, now let's discuss cardiotoxicity. What exactly is it?
Yeah, so I think before you talk about cardiotoxicity, we should talk about cardio-oncology in general, too. So cardio-oncology is essentially a specialized field that focuses on protecting patients' hearts as they undergo cancer treatment. So cancer treatment like chemotherapy, radiation therapy, or immunotherapy can all cause some form of cardiotoxicity. Okay. And that comes in a couple of different types of cardiac issues: hypertension, coronary artery disease, heart failure. And our goal in cardio-oncology is essentially to identify cancer patients at risk for developing these complications and try to see them early, manage the risk, and ideally prevent them from ever developing these types of cardiac issues.
So heart health is very crucial for cancer patients.
It's incredibly important, and we're starting to see that it's becoming even more important because of how long cancer survivors are now starting to live. With improvements in cancer treatment, cancer survivors are living much longer lives, but unfortunately they're also starting to develop heart issues years after their treatment is over. And so what we are trying to aim to do is identify the earliest signs of cardiac dysfunction in these patients so that we can adjust their cancer treatments, potentially start cardioprotective medications. And ultimately, the goal is to help these cancer patients not only just beat their cancer, but also go into survivorship with a strong, healthy heart.
Sure. What are some of the early signs or symptoms we can look out for?
It's an excellent question. So, symptom awareness is important. Shortness of breath, unusual fatigue, chest discomfort, swelling in the lower extremities and the legs can all be signs of potentially heart failure or some kind of cardiac complication. So if anyone has those types of symptoms, to please reach out to their primary care physicians or oncologists to help us.
Is that what you do then to learn more? I was just going to tell you, how can people learn more or reach out to get help?
Absolutely. So they can reach out to our South Denver Cardiology Clinic. You can reach out to our hotline. You can ask about our cardio-oncology clinic that way. We also have a website. If you search South Denver Cardiology Cardio-Oncology Clinic, we have a ton of information about cardio-oncology, who would benefit most from this type of a clinic. But I also recommend that patients reach out to their primary care physicians, their oncologists, to see if they benefit from a referral. So any cancer patient that is concerned about their heart, encourage them to reach out.
Okay, Dr. Manshad, thank you so much for coming on.
Thank you so much.
Important information there. Remember, you can watch all of our health interviews on our website. Just go to cbscolorado.com.